Hello, I'm Michael Hogue, CEO of the American Pharmacists Association. In the past month, I've been intensively traveling around the United States to visit community pharmacies and pharmacy departments in hospitals to get a closer look at the issues facing the profession. What I've learned, particularly this past week, as I visited some very rural pharmacies in southeast Missouri, was very disturbing and confirmed for me the urgency of a problem that is impacting nearly every consumer in America, as well as their local pharmacy. I don't record video messages often, so I hope you'll take the time to listen. I'm going to give you a couple of very specific examples, and then I'm going to make a request to you for action. Whether you're an APhA member or not, or a consumer, we all need to pay close attention to what's happening with our nation's pharmacy system. Community pharmacies of all types are struggling. Yet at the same time, consumers complain that the cost of their medicines are too high. So how is it possible that pharmacies are losing money on prescriptions they dispense, and yet consumers feel they are paying too much at the pharmacy counter? The answer is that there are too many corporations touching the prescription. It should be simple. Manufacturer produces a product. They distribute that product either to a wholesaler or directly to a pharmacy. And the pharmacy provides that medicine to the consumer at an agreed upon copayment or price. That copayment or price is actually either your employer negotiated price with the pharmacy benefit management company, or if you have Medicare Part D, your agreed upon price when you selected your Part D plan. Unfortunately, everything that happens once the PBM gets a hold of the prescription claim is smoke and mirrors. Let me give you an illustration from my travels. I visited the poorest county in Missouri. The local independent pharmacist in this town is a native of the area and feels an obligation and commitment to serve the people she grew up with. She loves her patients, and I directly observed that her patients truly love her too. While I was there, a patient came in who was illiterate. Unable to read the prescription labels, the pharmacist took time to draw a sunshine and a moon on top of the vial so that the patient would know to take the medicine in the morning and at night. Yet just last month, Express Scripts, one of the big three PBMs, performed an audit of prescriptions dispensed by the pharmacist. Express Scripts wanted proof that the pharmacy had actually dispensed the medication. They wouldn't take the pharmacist's word for it. The pharmacist provided all the information, including a copy of the signature log showing that the patient picked up the medicine. But that wasn't enough. Express Scripts auditors sent a letter directly to the patient requiring that the patient sign and validate that they'd picked up the prescription and return it to their offices via fax. Yes, that's right, fax. Who even has a fax machine in their house anymore? It's ridiculous. And not only that, remember, this patient's illiterate. She couldn't read the letter to even respond. A telephone call would have resulted in the patient validating that she'd picked up the prescription, but that's not what happened. Instead, Express Scripts determined that since the patient didn't return the letter, she must have not picked up the prescription. The result? The pharmacy had to pay back all of the money that they had received to the PBM, including the patient's copayment. You'd think that at least the patient would have gotten that. It was a heartless act of ignorance by a corporation focused on greed. Missouri's pharmacist told me that while all three of the big three PBMs are difficult to work with, Express Scripts is the worst. That doesn't mean OptumRx and Caremark are saints. The reality is that there's a lack of transparency in pricing, rebates, contracting, auditing, and payment that allow large corporations to take advantage of pharmacies who are not affiliated with their company. This has got to stop. If you're a pharmacist who works with one of the PBMs, let me speak directly to you. You are a pharmacist. APhA is for you, and we support your professional development, your career advancement. I know that you go to work every day to make a difference in the people's lives that you're responsible for. Don't confuse APHA's admonition of the PBMs with the thought that your professional association doesn't support you. We do support you, and frankly, we need your help. We think that many of these egregious auditing practices and contracting issues are happening without a pharmacist's oversight. Given the code of ethics that we all aspire to as pharmacists, we just can't imagine a situation where a pharmacist would engage in these unethical business practices. So we're asking you to start asking questions internally at your organizations about how they perform their audits and who's involved in their pharmacy contracting. Ask questions about why a contract results in pharmacies losing money on most of the prescriptions they dispense. We need you to stand up for your profession, stand up for what's right, and ensure that patients in every community have access to their local pharmacist. For all other pharmacists, you may be saying, Michael, I don't work in a community pharmacy. I hate it for them, but what can I do about this issue? The answer is very simple. We need to come together as an entire profession to make change happen. Everyone listening to this message should visit APHA's special website to send a letter to your member of Congress asking them to act during the current lame duck session. You can visit either pharmacist.com/ECAPS or npbmsnow.com. There are two bills that are equally important, and your members of Congress need to hear from you. One bill is in the House of Representatives, H.R. 1770, the Equitable Community Access to Pharmacy Services Bill, ECAPS. And we need the House to vote this bill out of the Ways and Means Committee right now. It's urgent. We also need the Senate to take action on PBM reform. Access to community pharmacists in 2025 depends on both of these bills getting passed right now in this lame duck period. Please take just a moment to take action. Forward this video on to others and ask them to do the same. Again, thank you for listening. The American Pharmacists Association is fighting hard to ensure that every consumer has access to the care services of a pharmacist whenever and wherever they interact with the healthcare system. APHA, for every pharmacist, for all a pharmacy. Thank you for listening.